I think when we are in training, oftentimes we have difficulty finding our niche, finding what we really want to do, because looking into the future is hard. I think the main thing is to actually follow that passion during the training. There's always things that during training which we find very interested in, or we are very much drawn into it, and just follow that passion in your head. Sometimes the heart rules the mind. Finding a mentor, I think, requires two things. One is having somebody who specializes in the area that you are interested in, but also the other side is important, the human side, whether you actually fit the mentor. There's no reason to find someone who is expert but have absolutely no interest in helping you. And in reverse, it's also true. You cannot just find a mentor who have a lot of personal interest but doesn't really know how to help you or what your specialty area is. So having those two complement each other is very important. I think it's important to know what you want. Oftentimes, when trainees go to having an appraisal or a meeting with a mentor, they are almost being too passive. They're expecting the mentors to tell them what to do. And that is true in our early career education, because when we went to lectures, we're taught that way. I think when it comes to a mentorship, appraisee or trainee situation, it's more important to be more proactive. Have a plan about what you want to achieve, things that you want to discuss, for example, and then actually bring it up during the meeting and discuss it that way. I think that would be a lot more effective than waiting for something to happen. It's a question that has come up more recently because I think trainees oftentimes wanted to decide to go one way or the other. I've actually come to realize that you don't have to choose one or the other. Ophthalmologists in private practice can still carry out academic stuff, for example, like research and teaching, and people in academic settings, for example, like myself. Obviously, we do clinical work as well. You can mix and match on these two things. I think sometimes not necessarily academic career or private career, the outside influence is more important in terms of making you choose which route you want to go down to. So I would say, like many things in life, practice does make perfect. So taking an example of the presentation, maybe the first time it may not be so easy, but I like to use resources both in text or even online, and watching how other successful presenters doing those tasks, and then learn from my own experience. That usually helps. And leadership kind of goes from that. When you are very successful in presenting stuff because you're good at summarizing information, presenting it in a logical way, and also able to digest the information and discuss it with the audience, you somehow actually become a leader in the field, and slowly people will come and find you and ask you to do various other things that you thought you would never do it in the past.